Thank you, planning team, for all of your hard work this morning. Thank you, everyone in the meeting space right now and on the phone. We're excited to start session 6 of our online weekly listening sessions during the COVID-19 pandemic. This is for the disability community here in Arizona, and we are the Arizona Developmental Disability Network. We are statewide. We're here to serve you. We're really happy to offer these weekly chats with different leaders from around the state. And today we're excited to welcome a team from the Native American Disability Law Center. They are led by the Executive Director, Therese Yanan, and she will kick things off for us today.
This is Therese Yanan. I'm the Executive Director of the Native American Disability Law Center. We are a sister agency to the Arizona Center for Disability Law, and work in conjunction with them as well as with the Arizona Developmental Disabilities Planning Council and the University Center for Excellence to address the needs of Native Americans, or to address the needs of people with disabilities across Arizona. Our areas primarily, our services are primarily focused in Northern Arizona, excuse me, especially on the Navajo Nation and the Hopi community. But we also serve some other northern tribes in our region. We'd like to talk with you today about several specific issues that are facing Indian country because of the COVID-19 crisis. We'll be covering services and issues within the Bureau of Indian Education schools. Also some concerns and questions we have regarding Indian health services. And then finally, what we're doing around monitoring and reviewing services in group homes on the reservation, as well as in the detention centers. I'll be starting with the issues regarding the Bureau of Indian Education. Right now, just for a brief overview, the Bureau of Indian Education receives funding from the United States Department of Education. And there are approximately 183 schools in 27 different states that receive funding through the Bureau of Indian Education. There are two types of schools that are operated by the Bureau. There are Bureau schools that are directly operated, and then there are schools that are funded by the Bureau but are operated and called tribally controlled schools. Regardless of the type of school, under the Individuals with Disabilities Education Act, the Bureau of Indian Education remains the state educational agency for these schools. Right now, there are about 64 schools across the Navajo Nation that receive funding from the Bureau of Indian Education. 54 of these schools are in Arizona. With regard to the Individuals with Disabilities Education Act, the Bureau schools are still legally obligated to provide a free and appropriate public education, including procedural protections and compensatory education if there is a failure to provide services. At this point, because of the COVID crisis, many of the schools are closed like all of the other public schools in our area. On March 14th, the director of the Bureau of Indian Education, Tony Dearman, sent a letter to all schools advising them to close and to take steps to protect staff and children. Since then, we have tried to get in touch with various individuals through the Bureau of Indian Education to determine what, if any, other guidance was going to be provided to these schools. To date, none has been. We were told by an attorney with the solicitor's office that they were working on guidance and that it would be sent out by the end of March. We have not received anything from them. On April 21st, we sent a letter, excuse me, to Mr. Dearman, specifically requesting that guidance be provided, as many of the states have done, so that schools knew what the expectations were and what steps they could take to ensure that students received services and that the schools were acting in compliance with both the Indian Education Act and the Individuals with Disabilities Education Act. we have not received any response, either from the Bureau or from the Solicitor's Office for the Bureau of Indian Education. The Bureau also received a little over $153 million in the CARES funding. Right now, there's been no plan on how they're providing or how they're going to use those funds. Excuse me. They're providing, or they are conducting 2 listening sessions so that they can receive input from tribal entities and tribal leaders on how they should be using those funds. They had one yesterday, and they're going to be conducting another one tomorrow. Based on our review and just the input that they're receiving at this point, there's primarily concerns about using the funds to support existing services. And there is some, there were comments along the lines of whether or not it would be focused on the K through 12 schools or would also be going to tribal colleges. At this point, we at the Law Center don't have any position on how the money is divided among the different educational entities, but we were disappointed to hear that there was no mention of providing services to students with disabilities. What we're seeing at this point, we've been in touch with most of our clients who have children attending Bureau schools. We sent them out some suggestions in mid-March when the schools were shutting down on tracking services and how they could request those services. Most parents, of course, want their children to continue learning. As many of you know, the Navajo Nation has been hit particularly hard by the COVID-19 virus. And there is obviously a concern of keeping people safe, but there's also a concern about children regressing and losing progress and losing educational opportunities. What we've been able to determine through contacts primarily with other attorneys who are representing tribally controlled schools is that the schools are taking different actions in response to the situation. We think this is especially problematic and also indicative of the lack of guidance that the Bureau is giving. We've had some input that schools are also changing their activities almost on a week-to-week basis. At one point, one of the schools that we've heard about totally stopped services across the board and just told related service providers and everybody involved that there wasn't going to be anything further for the rest of the school year. And then the following week, they tried to resume some sort of services. Some schools are taking a position that any sort of educational activity is voluntary. Others are just trying to provide services and doing the best they can in the situation. The things that concern most of our clients at this point is there are significant communication issues. In our area, many families have cell phone service, even when it's spotty at different parts of the reservation. But there's been very little communication. And even when parents are reaching out to schools, they're having a real difficulty connecting with school staff. There's also been real inconsistency about providing services or conducting IEP meetings. Some schools have said that they're not going to be conducting any meetings, where we know that in other situations, especially in the public schools, we've had meetings being conducted using this sort of mechanism or even conference calls. So some public schools are still proceeding with activities where the Bureau schools we're seeing are having much more difficulty getting services off the ground. The due process protections remain in place. And so there are still avenues for parents to reserve their rights and their children's rights to services. And as I said, we're trying to help parents track those services so that we can address any deficiencies and hopefully help obtain compensatory education should the time come. I hope this has been helpful and not either too detailed or too broadly based. But Sarah, that's all I have for now. Would you like to go questions as we go through each topic?
Sure, yeah, just a reminder, anybody who is maybe navigating one of these specific issues with the schools right now, feel free to comment in the chat, and Therese or one of her team members can respond. But feel free to head to the next topic if you're finished with the school one.
Yeah, this is Nick, and I'm just going to remind everyone, if you do have a question, the chat is a great place, and I'll be making sure to read all the chat questions out loud so that people on the phones can hear them. The other way, if you want to share verbally and you're joining by a computer, you can raise your hand by clicking the participants button at the bottom of the meeting screen. And then what pops up on the bottom will be a little raise hand button. So you'll click that and you'll raise your hand, and we'll be able to see that, and we'll unmute you and call on you. If you're joining by the phone, you type *9 on your phone. That will also raise your hand on the phone, and you'll be called on, and we will unmute your phone, and I'll identify you by the last couple digits of your phone number. So far in the chat, we have some awesome people that are introducing themselves and talking about where they're joining from. We have some people, Meredith from Hopi VR is on the line. We have DDD representation, someone from the community engagement, and also someone from the southern region who serves tribal areas there. And then we have someone from a school psychologist, a special ed director from Yavapai and Coconino County, who also provided his email if you have questions, and someone from a behavioral hospital as well. So definitely share where you're joining from, but I'm going to send it back to the speaker now to keep going on to the next topic.
Okay, thanks very much, Nick. Annette Yazzie is an advocate with the Native American Disability Law Center, and she will be speaking about the issues and some of the concerns we have with regard to the Indian Health Services. Annette?
Okay, can you hear me?
Yes.
Okay. Hi, my name is Annette Yazzie, and I am Dene. I'm from New Mexico, and currently I'm working out of Flagstaff. We're getting ready to open up a Flagstaff office, but I'm an advocate with the Native American Disability Law Center. And I want to share with you a problem affecting Native Americans with disabilities in Indian country. Specifically, I want to talk to you about the levels of medical care everyone is entitled to when they go to an IHS hospital with COVID-19. Ideally, when someone is sick, they get the treatment they need to make them better. But when many people are sick at the same time in a crisis, such as this pandemic, the healthcare system can't treat everyone. So they have to make decisions on who gets the medical care. And it could be because maybe they have too few doctors and nurses, or too little medicine, or not enough medical equipment. This situation is called medical rationing. And so different states have their own medical rationing plans, and some of them are called, I researched a few, and I think I've seen guidelines titled as like emergency crisis plans, crisis standards of care, rationing plans for some states, but there are guidelines set for in the situation of emergencies where the medical providers are given some guideline on how to allocate medical resources. So right now, Indian country, as we all know, is experiencing an increase in COVID-19 cases at an alarming rate, and the number of patients who are sick may be more than the IHS hospitals and facilities can treat. According to the IHS website, as of April 26th, there are over 27,000 that were tested, and 2,973 were positive. But I just wanted to highlight in the Navajo area, of these 2,973 that were tested positive, there's a large amount of this, which is about 1,880, which is very alarming because of how fast the cases have increased, and they're still increasing. So last month, the Office of Civil Rights for the Department of Health and Human Services published guidance that requires hospitals to comply with the civil rights laws that protect people with disabilities, like Section 504 of the Rehabilitation Act and Section 1557 of the Affordable Care Act and the ADA. This guidance includes 5 guiding principles that must be included in implementing medical rationing plans during a crisis such as this pandemic. Those five guiding principles, one is that when implementing these plans, decisions must be made based on individual situations. For example, the plans cannot say that all people with a certain disability will not receive a particular medical resource. 2, decisions cannot be based on assumptions that people with disabilities have lower qualities of life, or 3, that people with disabilities have a lower prospect of survival. 4, decisions can't be based on a perception that people with disabilities have higher treatment needs. And the last one, people qualify for COVID-19 treatment if they need it and it will improve their health. That is that they get the treatment because they have the virus and not based on a disability. How does this apply to IHS? The Indian Health Service is the main healthcare provider for over 2 million Native Americans in 37 states. It's also a federal agency under the Department of Health and Human Services. So IHS hospitals must comply with these guidelines. However, right now, IHS hospitals have not made their medical rationing policies available for public view. So the issue here is that we're not sure if they are following this guidance from HHS. People with disabilities are at risk in a medical rationing situation because of stereotypes that their life is not worth as much as someone without a disability, or that they have a lower quality of life because of their disability. An example of a rationing plan might hold that a person with a severe intellectual disability will not be provided a ventilator, or that a person with a neuromuscular disorder will not receive care in time of shortage. This is wrong, and people with disabilities need to know that they and everyone else have a right to be considered for medical treatment regardless of their disability. At the present time, there is a possibility of medical rationing for COVID-19. It's possible that when someone with a disability goes into an IHS facility or a testing site, there might not be enough tests or doctors and nurses or medical equipment like ventilators to help them breathe. A person with a disability has the right to be considered for the treatment and equipment they need through the same framework as anyone else. These rationing policies based on disability violate federal disability laws and prevent equal access to life-saving healthcare services. So what I've been doing in my advocacy is I've actually sent several emails and phone calls to people listed on the IHS.gov website. And I've asked if I could obtain their medical rationing policies, and or to let me know where I could find it, or get me in contact with someone who might be able to give me the information. Unfortunately, we have not, I haven't received any calls as to where I could find this information. I did receive a few responses from several area IHS representatives in other states like South Dakota, Albuquerque, Oklahoma, and in California, but they only referred me to their public affairs department. And I still did not obtain any information about the medical rationing policies or any guidance as to what IHS is going to, what guidance IHS is going to notify their facilities across Indian country. And other things that we did in the office is my supervisor who just spoke, Therese Yanan, she sent out a press release, which I saw in Indian Country Today and Native News Online, expressing our concern. Our community liaison, Hosky Benali, also made attempts to call several of our tribal leaders. And we also produced a video explaining this issue for people with disabilities, where I provide information about and recommended to them when, in the event that they actually visit a IHS facility. And I provide recommendations to them. For example, I explain to them if they did request care at an IHS facility, that they be prepared to advocate for themselves, that they should know the 5 guiding principles that I mentioned, and if they are not equally considered for treatment, to let the staff know what they are doing is wrong and illegal. I also point out in the video that it helps if they have a family member with them to make sure that they get the treatment they need. And if they are denied medical treatment at an IHS facility, that they should, when they're actually in the facility, that they demand to speak with the doctor in charge or the chief medical officer, and tell the medical staff that they are violating HHS guidance. And at a later date, when they could, that they should file a complaint with either IHS or HHS. And other things that they could do locally in their community is that they can actually contact their area IHS director, their tribal and council leaders, their local news media, or their local protection advocacy rep. And if they're located in the Four Corners area, they can contact our law center. The last thing they can do is post on their on social media platforms like Facebook or Twitter, voicing their position on the issue. Well, I hope that this information I provided was helpful to you. That concludes my presentation. Thank you.
If I can add to what Annette was speaking about, we also have been in touch with members of the Navajo Nation about this issue. As many of you maybe have been tracking the activities on the reservation, they have a response team that is in place. And they have, the tribal council is considering a resolution to support our request from IHS to provide and publicize the guidance that they've been providing to their offices. So hopefully we'll be able to get some movement. As Annette mentioned, one of our primary concerns comes from the fact that they're not publicizing anything. And so what we suspect is that they don't have anything in place. And so again, it leaves people without proper direction.
So we have a couple questions in the chat. The first question is going off of some of the stuff that the speaker was just talking about in terms of advocating on social media and other places, and wanted a little bit more information about that, and wondered if your organization had promo materials or some talking points that you could share so that people could have a coordinated message on social media.
Yeah, I actually can make that video that I just mentioned available. Sarah, I can send that to you, or if you have any other questions after this this meeting, you can also contact me. I'll leave my email with Sarah as well. And if Therese, okay, so maybe we can share that press release.
Sure, we can share the press release and the letter to IHS, and then we were hoping to get more of a response to the letter, especially and to the press release. So we have drafted up some talking points that we can also share.
Thank you. Another question in the chat from Heather. It's my understanding that family members can't be with their loved ones who have COVID-19. Is this also true in IHS facilities?
Oh, I think we had actually discussed this a while back, and I'm not sure. I think we had an individual that was in this situation, and Therese, I can't recall what we discussed about this, but could you maybe chime in here about this?
Sure. I think that I think it varies from facility to facility, but we're going to start looking into this issue as well. We were really trying to focus on moving things forward on the medical rationing, but agree that the visitation policies is the next issue that we'll be facing, I think. At this point, I'm not sure what policies the hospitals have in place.
Sean asks, if a member is denied services and care, to whom should they file a complaint?
Well, if they're located in the Four Corners area, they can contact our law center. But every state does have a protection and advocacy system that they can contact if they're in other areas other than the Four Corners area. But I mean, if they're denied service that day when they're in the hospital, they can point out, like I said earlier, that they can point it out to the staff that they are violating disability law. And I'm going to send out that video, which gives more details about that.
And there's also a complaint process through the IHS. Annette, can you review that real briefly?
On the IHS website, there is a link where you can enter your information, and it explain, or you can actually point in, explain in the complaint, pointing out which facility and the facts about what had happened. And I'm not sure about the turnaround time on the complaint and how fast they get back to you, but it is on the website. I can make that available also.
We also, of course, recognize that that's an imperfect way of addressing the issue. So we're prepared to assist anybody who has difficulty along these issues.
So I'm going to keep going to the chat, but I want to remind everyone that if they want to verbally ask a question, they can raise their hand by clicking the participants button if you're joining by computer, and then at the bottom there's a little raise hand. If you're on the phone, you can dial *9. That will raise the hand. You'll be called on in both those cases. So there's some very helpful links being shared in the chat. John Myers from the ARC has shared a link about a story collection tool that they're running to collect stories from persons with individuals with disabilities and their caregivers about during COVID. Sarah has shared the article from Indian Country Today, the NADLC press release. John shared a link to IHS's website in general, if you want to poke around there. Ken has shared some well wishes for friends and neighbors in Indian Country. Thank you, Ken. So a question, and I don't know if the speakers will have information on this, but I want to ask it. Have there been any updates about testing for COVID-19 in Indian Country?
The updates that I've been looking at are specific to the Navajo Nation, and I've also been viewing the ones on that are being reported to IHS facilities. But altogether, on IHS facilities, there are 27,188 tested, and of those, 2,973 are positive, and that's as of April 26th.
And Candace asked, kind of clarifying, do you know if there's standards for testing on the reservation? Are those the same across all reservations? Is it kind of different? Do you have any sense of that?
Oh, I don't know. I can't answer that.
As a reminder, if people on the call want to answer questions too, the chat is a great place for sharing information. I want to go to a question from Natalie, who's asking, it's a follow-up about the complaint process. And the question is it the same for facilities operated by Native Nations themselves, like the former IHS facilities in Sells and Tucson?
I'm not sure how to answer that. I think, well, the complaint process that I'm looking at is the one on the IHS.gov website, but as to whether there are different complaints, I didn't read anything on that. But I can find out. If this person wants to email me, I can maybe follow up with them.
Those facilities are probably run through what are called 638 contracts. And so typically in those contracts, the tribal entity takes over the services and provides the services, and the services are either provided through the tribe directly or through a private entity that's tribally related. But many times those contracts still require some sort of complaint process. So the complaint process is probably slightly different, but I'm sure that they would have one. I'm actually looking I'll look into it right now as we continue talking.
Question for you, Annette. Would you like me to share your email in the chat box so people can get in touch with you?
Yes, thank you for doing that, Sarah. And also, if you could share that video as well. And that's another way that people can get this information out, is feel free to share it.
Great. I may need to have you email me the video. I didn't see it in my email, but if you share that, I'm happy to put that in the chat.
Okay, I'm sorry. I guess I forgot to send that to you. Thank you. I'll do that.
No worries. We'll get that in there.
Okay.
Are there any other questions out there in Zoom world? Reminder to raise your hand on the computer through the raise hand function, or *9 on your phone, or share it in the chat. All right, here's a question from Meredith to Therese. What can parents do for their students in special ed to get assistance for their online classes?
Well, thank you for the question, Meredith. I think that this is precisely some of the things that we're trying to follow up on. Our first recommendation would always be for the parent to contact the school, but we know that there are a lot of difficulties with that. The schools should be providing both equipment and potentially even hotspots to facilitate the connectivity, and so that students can access their online classes. But you know, a lot of that just goes back to the communication. If there are specific parents in the Hopi community, please feel free to connect them with us, and we'll be happy to assist them either through the state complaint process or any other process that might be appropriate for them and their family.
Yeah, Meredith shared that, yes, she agrees communication issues have been an issue. And I know from one of our programs that works with tribal VR programs around the country, you know, connectivity and ruralness have never been bigger barriers than they are right now. So,
well, and it seems like the experience we've had just following up with schools on different issues is, you know, a lot of offices, of course, you know, people are working remotely. You know, you can probably see my kitchen behind me, you know, this sort of thing. But it's, but we, you know, people are still checking messages. People are still have at least one person in the office. I mean, that's what we've seen through a lot of our colleagues. I'm sure a lot of these programs, a lot of the people on this call have a similar setup, where we're calling schools and there's nobody there and we're having a hard time getting a call back. So we're experiencing the same difficulty that parents are. So it's, you know, unfortunately we don't have a magic wand for it. But the thing we do have is access to their lawyers. And so we will take steps to help parents enforce their rights.
So there's a question about ESA homeschooling funds. The question is, has there been any progress with folks being able to access ESA homeschooling funds, to connect with the funds?
Okay, I'm glad that somebody commented that those are Arizona Department of Ed funds, because I haven't heard of them in reference to the Bureau. So it might be, this is the type of thing, like we're hoping that they'll be able to use some of that $153 million to help help schools provide this sort of connectivity for their students.
Thank you. I think perhaps the question about asking about progress was because we had some AZ Department of Ed people on a call a few weeks ago that were talking about this, working on this.
Okay, great. Okay, if there's our funding separate from. Okay, do you mind if I go with this?
Yeah. So let me just read the question so people
Sure.
on the phone can hear it. The question was, are the funding separate for BIE and state funding?
Yes, the funding is definitely separate. There are similar types of funding streams. So the Bureau schools, the funding goes from the United States Department of Ed directly over to the Department of Interior and down to the Bureau of Indian Education. So, but the funding is absolutely separate from the public schools. So while some communities may have a public school and a tribal school and a Bureau school. So for instance, it's very common on the Navajo Nation that they have Arizona public schools, you know, within miles of a Bureau funded school, but those schools are totally separate and the systems are totally separate. So where the Arizona public schools have to comply with Arizona state law and Arizona regulations, it's much less clear for the Bureau funded schools what their what regulations and what policies they're following. So they do not have to comply with any guidance that's being provided by state departments of ed, which is why it's so important for the Bureau to provide that guidance and that input for the schools. And schools typically are not getting both funding streams. So they're absolutely separate. And with the separate money comes separate regulations and policies and that sort of thing. And then even under the Individuals with Disabilities Education Act, there are some portions of the regulations that do not apply to the Department of Interior schools. So in deep into the federal regulations in the back, there's a section that specifically applies to the Department of Interior, which is the supervising federal agency over the Bureau of Indian Affairs and the Bureau of Indian Education.
So Gail clarified that the ESA acronym stands for Empowerment Scholarship Account, and she encourages people to do some research about that if they want to see if it might be applicable. And then Sarah shared a link to arizonatogether.org, where there's a big section on internet services. Yeah, there's some, I didn't mean to be pessimistic about talking about rural connectivity. There is some innovative things going on right now, and I really do hope it continues. Therese, I know you said if there was a lull, you maybe wanted to share something else. So I don't know if, I don't see any other questions. Oh, here's a question from Candace. Do any students with disabilities have to file a complaint in different places as far as accommodations or on discrimination issues?
Yes, so the Bureau of Indian Education has a separate dispute resolution process. And so they still have to comply with state complaint processes and due process hearing procedures. They still have to provide those dispute resolution processes, but again, they're totally separate from the state. And so that the state complaint is actually filed with the Bureau of Indian Education, and a due process hearing request is filed with the Bureau of Indian Education. It doesn't go through the state. So it's a similar process in that those regulations around time periods and the scope of the rights is the same, because that goes back to the federal regulations, but the actual process that's set up is operated in a different way. Okay, and I think,
Yeah, just wondering, and it doesn't have to be right now, but is there a link to, if someone has questions about the laws governing BIE schools?
we have some materials that we can share. Unfortunately, the Bureau of Indian Education has never finalized regulations or procedures that most states have in place. So for instance, if you start out with the Individuals with Disabilities Education Act, and then you have the federal regulations. What most states have done is then they've filled in some of the spaces that are left by those federal regulations. The Bureau developed some years ago, I believe it's 2012, a set of proposed procedures. But in our experience, when we've tried to use those procedures, they say that they're in draft form and that they're not bound by them. And then we brought up the issue of the lack of regulations in one of our due process hearings on behalf of a student attending a Bureau school. And the hearing officer, who's a hearing officer within the Department of Interior, found that while SEAs, state educational agencies, can provide further procedures and policies, they don't have to. And so we were unable to use that as a lever of getting the Bureau to fill in some of the gaps that are left by the regulations. So unfortunately, with the Arizona Public Schools, you can go right to a portion of the administrative code. With the Bureau schools, that's not really readily available. But if anybody has a specific situation or a specific question regarding a student attending a Bureau school, we would be happy to help address it. We know it's sort of a nuanced, esoteric area that only 2 or 3 of us really delve into in our geekier times. And so we have some experience with it. And so we'd be happy to help anybody talk through or work through any issues that they're facing on behalf of students. Okay, we have another colleague who's on the call, Jessi Jones. She did just text me that she's having some internet connectivity challenges, speaking of connectivity issues. So hopefully Jessica's on and she can talk a little bit about what we're doing regarding monitoring facilities and the detention centers.
I think I've just unmuted Jessica.
Okay, I'm here.
Do you want your video on?
Yeah, sure, that's fine. Okay. Well, yate, Oze Techini Nishlan, Tapahamba Shishin, Kiani Dashache, no Dai Techini Dashanella. Good afternoon, everyone. My name is Jessica Jones. I'm an advocate also with the Native American Disability Law Center. I'm going to talk a little bit about the facilities that we monitor on the reservation, near and basically on. So one of our priorities as a protection advocacy is making sure that we monitor the facilities. And so that includes group homes, as well as detention centers. So one of the group homes, actually I'll start with the detention centers. So there's actually, Navajo Nation has 6 detention centers. Currently, 2 of them are just holding cells. So we actually monitor 4 of those detention centers. And so 2 of them are in New Mexico state side, and 2 of them are on the Arizona side. And so one of our biggest, concerns are also at this time, and I think if we haven't followed some of the information, it's also that these congregate settings can also include detention or prisons. And so one of the things that we contacted lieutenants of those detention centers to making sure we asked a couple of questions regarding what is their policy regarding COVID-19, has anyone been released that is vulnerable to this virus? How are individuals kept at a safe distance? What are kind of the quarantine practices? Is it sort of separated if they have new people that are being detained at the time? And so we were able to get some of that information. We didn't have a good understanding about their policies. We've kind of understood a little bit about from what we were told. And so we wanted to make sure that there's actually written policies in place. And so we've actually requested for those policies through Navajo Nation Department of Justice. And so we're currently waiting for those policies still. And so hopefully we can get them so we at least know what's going on the ground, or at least what's written and should be put into place. We've also reached out to other people that are detained there that we've met through our recent monitorings. So we've sent surveys to them and just trying to get a better insight as to what's actually going on within the detention center. Are they getting their daily or hour breaks? Are they being able to access different services? I mean, what is the mental health issue of people that are being detained there? So we really just want to make sure that we're trying to reach as many people, and if there's any concerns, that we're able to get in contact with them. I think that's just our biggest concern right now, is being able to have them in access to us if they need us. So one of the great things I think out of all of that was that the Navajo Nation Detention Center has already half their population in each of their detention centers have gone down. They've been released. So there's a little bit more of a flexibility of having people isolated, or at least being put into separate, having that social distancing within the detention centers. So that's where we're at this far with the detention center. And two of our concerns, I guess, are mainly with Tuba City and Kayenta. Those detention centers hold up to a good number. I mean, Tuba City, I think it's about 120 beds. And Kayenta, their total number usually is around between 60 to 70 people. And so right now we've been told that at least half of that number, if not more, have been released. So that's a good thing to help mitigate this virus from spreading. Kind of moving over to group homes. So group homes, we monitor 3 on the New Mexico side, and we also monitor 3 also in the Arizona on the reservation. And so same thing we did for those is we contacted the directors and asked them a couple of questions. Same thing about, what are their guidelines? What is a policy? How are they getting staff to making sure that they're not coming, that they're getting their temperatures checked? So basically, we just, again, wanted to know what's happening from their perspective, and also understanding Arizona DDB's guidance, that's also being practiced and followed. Also, other things that come into our mind is also making sure that people, if they're being tested, what's that process like? How do staff get transfer and also come back? And so we've been able to get some information about that process, as well as on New Mexico side. And also for individuals that do get tested positive, what does that look like? So luckily for us, and thankfully, none of, so far, at least from our understanding, none of the individuals that are at these group homes have been tested or needed to be tested. So that's a great thing too, because these are group homes that are kind of in the hot spots on the reservation at this point. So it's really great to at least know that none of these homes have been infected, or at least being tested or having the need to be tested. One of the challenges I think at this point is doing virtual tours, anything that has internet access, mainly because the group homes don't have the equipment for this, or computers that even have cameras for it. So more likely we're just sort of limited to getting telephone calls and trying to check in again with individuals. We also have individuals that are clients of ours in these group homes. So we also can understand if there's something going on inside that we can actually address, or find a way to at least get it addressed. Some other things also, like PPE that we're finding out is part of that process. I think all of us, everywhere is a low amount of numbers. And so one of the group homes that we monitor kind of was running into this problem. And I think we're trying to, I think we've contacted the council, one of the council delegates, Navajo council delegates, and being able to coordinate that, because my understanding is that Navajo Nation is getting donations. And so at least maybe connecting them with those donations and how can they work together. So that's kind of one thing that we're trying to help out in those situations. There's also areas too that we're also now looking into, especially with the CARES Act, with the stimulus checks and people that are getting SSI payments. And so those stimulus checks are coming in, but we also want to make sure that directors, group homes, are educated about how the money should be spent, and how it's not part of the room and board. It's not part of the individuals or beneficiaries' income. So that's another thing that we're on the next step of addressing, at least by this week, if not by early next week. And so those are just some kind of things that we're, it's kind of a process that we're trying to, every week is something different. And I think we're just always trying to make sure that we're in touch with people and being able to have that access available if they need it. So, and I think that's about all that we are at this point, as far as our monitoring, our virtual monitoring here now. So, and that's the end of my presentation.
Thank you very much, Jessica. That was very interesting to listen to. As a reminder, if there are questions, to use and you're joining by computer, click the participants button and then the raise hand at the bottom to raise your hand to be unmuted. If you're on the phone, you can dial *9 to raise your hand for a question or comment. Otherwise, you can keep the questions and comments going in the chat. I'll make sure they get routed. Sarah is especially appreciative about information about detention centers. So thank you, Jessica.
And I just want to invite anybody who happens to be on the call or in the Zoom meeting online. If you are in the southern or central Arizona region and you are experiencing issues that we've talked about today, and maybe want to provide some insight. I know, Natalie, you mentioned a facility in Cells in the Tucson area. Please speak up. We know that some of these issues are statewide, and so feel free to share with the group.
Hi, everyone. I'm Natalie Luna Rose with the Arizona Center for Disability Law. That actually was one of my colleagues. She's kind of sharing my link, and she had to jump onto another call. But she did used to work out in the Cells area before she joined us here at the center. So her concern is, you know, what kind of services are happening out there. She used to drive all the time from Tucson to Cells several times a week, and saw that it was really tough for not just herself as a, you know, somebody going to out there, but for families and the community. So I guess more her question was, is like, is any focus being made to, especially with the fact that Cells is so right on the southern border, and there's a wall going up, and all these other issues, you know, the Tohono O'odham's got half, you know, a good portion of their tribe, you know, that's technically across the borderline. How does COVID-19 affect any of that? And are there services for those tribal members that, you know, like I said, live technically below the United States borderline? So those were one of her questions. And I don't know if that's, anybody can give a good answer, but.
I don't know quite that much information about the South Native communities in Arizona. So I don't know if anybody else might have some available information that might be helpful.
Yeah, I will, seconding Jessica, I will defer to anybody who is more familiar with the region and the issues down there. I can tell you that what I'm looking at is that the Cells facility is a 14-bed facility. And what happens a lot of times with IHS facilities across the board is that they are sort of a first line of defense, and then they transfer people out to the larger urban areas. So I'm assuming that that's what also is what the Cells facility is doing. I know that that's the facilities in our service area. Many people are being transferred down to Phoenix or even over to Albuquerque in the UNM facility. So there's still some serious issues there, but it's also a matter of people probably being transferred up to Tucson. But I'm sorry, I can't speak to those issues more specifically. While we were on this call, some of our colleagues were on another call with the National Congress of the American Indian, or for the American Indians, and they were talking about IHS. And so I actually did just get a notice and an update, which is timely. IHS is expecting to publish a policy statement that their services are being provided in a non-discriminatory manner. But he also confirmed that IHS does not have a medical rationing policy per se. I'm sorry, he refers to the Rear Admiral, who is the director of IHS at this point. So he did confirm that they don't have a policy, but apparently they're working on one and will release it soon.
Thank you for that. Sean, who is from DDD in the southern region of the state, has shared a comment. He says, from my experience of working with the Navajo Nation, there is a lack of care providers due to there not being nearby agencies. Family members can be providers, but there are a lot of legal issues with people who cross the border, even though it is still part of the Native Nation. This affects members during COVID and not during COVID. This is the biggest barrier that he has seen down there from those members, or they have seen.
And that seems to be some of the issues that we're running to here, because I work out of our Tucson office. So if there's anyone that can, I mean, I'll definitely put my email in the chat box, but if there's anyone who can help us with some more contacts with any of the southern nations down here would be much appreciated.
I think probably to also, I mean, it kind of also is a little bit similar to what I've seen in regards to, like, if we were saying the reservation borders within Mexico side of group homes, because, you know, there are instances where there might be abuse or neglect happening. And so sometimes family members don't have that, there's either not a family member to provide those services, and so they get placed into group homes. And so it's pretty interesting to kind of find out how when those people are placed, you know, into a group home, that they're tribally funded, or, you know, so there's a big difference between somebody being tribally funded versus somebody being state funded, and how much those funding sort of give a lot of services, or they don't give as many services available for that person. And so I think that kind of a little bit maybe kind of speaks a little bit about that. But what we've been doing is, you know, also work with the tribe and possibly going into the state to seeing how we can sort of fix those issues, or at least address those issues, because I don't think that it's something that's kind of seen you know, on a bigger picture, I guess.
Is anyone out in Zoom world who lives on or near Indian country, have you experienced COVID-related challenges that haven't been talked about today? Are there things going on in your community that you haven't heard people talking about on this call that you want to kind of share and crowdsource and think about some solutions? We have quite a panel of experts here, so I just want to reinforce that. If you're joining by the phone, it's *9 to raise your hand. And if you're on the computer, it's the participants button and then raise hand at the bottom.
I have a question for our panel. Has there been any success working with local lawmakers to raise more attention to, for example, the letter and the press release written to BIE regarding the guidance, whether that's at the, you know, congressional level or tribal council level? And maybe you mentioned it briefly and I missed it, but have any local lawmakers really stepped up to help advocate?
One of our colleagues, Hosky Benally, has been in touch with some people, primarily at the tribal council level for the Navajo Nation, and trying to sort of raise awareness. And then we've also been in touch with the congressional delegations of Utah, Colorado, New Mexico, and Arizona about the Bureau issues. But the response there is there's a lot going on the national level, as we all know. But the larger tribal council is considering a resolution tomorrow that is supporting our request to IHS to publicize some guidance and policies around how they're providing services.
So there's a question in the chat asking about elderly people who live alone in rural reservation areas. Can anyone share, like, have you heard of ways that these folks are getting oxygen tanks or food or systems in place to take care of these residents?
Well, from what I know or understand, is that so the Navajo Nation president has like town hall virtual meetings, I believe every Tuesday and Thursday at 10 Mountain Standard Time. And from my understanding is that they have a command center, and they also are getting donations. And so I think that they're coordinating between those two. I know Annette was talking a little bit about that because we were trying to see how those donations are being distributed. So I don't know, Annette, if you might have anything else to add to that.
Well, I've also been participating in those town hall meetings, and last week during one of the town hall meetings, one of the presenters mentioned that they were their Division of Community Development Director, Dr. Perlman, Dr. Yellerman did mention that they were sending out care packages to those considered high needs, which were elderly people living in rural areas. And as to the ventilators or medical equipment, she didn't mention anything related to that. And so the care packages, I believe it was food and I believe it was gloves, but not anything as to anything related to medical equipment.
There's also been some stories in the Navajo Times. I think that what some of the different branches are doing is that they're helping with distribution efforts, since there are restricted ability to maybe perform some other functions because of the restrictions on movement and things like that. So it's like everything else, people are doing the best they can with what they got. And I think it's probably not a perfect situation, but I know that there are efforts being made in the community to meet those needs.
Is there a way people can access those town hall meetings?
Yeah, so if you go to the Facebook of the Navajo Nation president, Nez and Lizer, and Vice President Lizer, you should be able to get onto those. And they come live, I believe at 10 Mountain Standard Time, Tuesdays and Thursdays. And they actually had one, although I think they changed their schedule for this week because they did have one scheduled for today at 10.
Looks like they're recorded as well. So I think
Yeah.
people might be able to see previous ones by going there too. I shared the link to the Facebook in the chat.
Nice. Thank you.
And they also have them available. I believe it was on KTNN and KNDN at 6 o'clock in the evenings on the radio.
All right, we got about 10 minutes left on our allotted time. So I want to give one last chance for questions in the chat or through the raise hand function, *9 on the phone. So I'm going to give just one more minute here in case people are processing or typing, and then we're going to send it over to someone to close.
While we're giving people some time, I'd like to really thank Sarah and Natalie for including us on these sessions. We really appreciate the opportunity to provide some information about the issues that we're seeing. Anybody who's on the call, if you have any questions, please don't hesitate to call us. As I said, we have people in the office and messages are getting passed on, and we're doing intakes for clients and that sort of thing. And even if we can't help you directly, hopefully we can help think through some issues and troubleshoot, or at least start to try and find some answers. So thank you so much, Sarah, Natalie, and thank you everyone for your interest. We really appreciate it. And please just don't hesitate to contact us if we can help with anything.
Well, thanks, Therese, and Jessica, and oh, I forget to get the last, all your crew. Thank you. Annette, there you are. I had to scroll through your name real quick. So Jessica and Annette, also thank you for joining us. If there's no more questions, I think we will wrap up for today. We have, this is our 6th session. So I can't believe we've gone through 6 weeks already, technically, of living through COVID-19 and working through it. And so thanks to everybody, not just our speakers, but everybody that joins us for these weekly calls and for all the work you do and the advocating you do on behalf of people with disabilities. We're obviously busy here at the Arizona Center for Disability Law. We are open. So I did come into my office today, but normally I'm working from home. And I did put my email in the chat. So if you have any questions, follow up, whether it's to this session, previous sessions, or something, you know, in terms of any legal issues, please feel free to email or contact any one of us, our name of my network partners as well. Today is supposed to be a very hot day in Tucson and probably in Phoenix. So jealous of those of you who are from Northern Country or New Mexico, where it might be a little bit cooler. So be well, be safe, drink lots of water, and we will have another call next week. Not sure what the topic will be, but you'll definitely be getting an email like you did to register and what the topic will be. So if there are any questions, I will let everybody go.
Thanks. Take care, everyone.
All right. Have a good day, everybody. Take care.
Bye-bye.
Thank you.